We are back with Dr. Rachael Wruble, the president of the North Carolina Optometric Society. She is answering your eye health questions today, and we're getting a lot of people texting in questions, Doctor. One person is saying that they get tiny white bumps on their eyelids. Is this a problem?
Yeah, it depends on the location, but definitely something to get checked out. Typically, we can see white bumps along the lid margin, kind of right where the eyelashes touch the eyelids, and that can indicate there could be blocked oil glands, where the glands aren't releasing the oil, and that can lead to dryness, redness, irritation of the eyes, and even blurred vision that comes and goes. So definitely something to get checked out to make sure you're getting proper treatment.
Someone texted us asking, after a detached retina, will your eye ever see correctly again?
It varies among every single patient. I always tell patients, if you ever notice flashes of lights or floaters in the eyes, sudden onset, call me right away. If we can catch something like a retinal detachment or a retinal tear within 72 hours, we have a better chance of getting surgery and having a better prognosis or better outcome with the vision.
Someone asked, as I get older, my vision is getting more and more blurry and I get headaches almost every day. Should I be concerned?
Definitely want to see your eye doctor about that and make sure you have a proper prescription. It could be that your eyes are straining from the eye muscles not focusing properly. And the headaches can be indicative of so many other things. So that's why it's important to have the health of the eyes checked. Things like the optic nerves, make sure there's not swelling or fluid surrounding it or behind it, to make sure everything's okay.
We got a text. Someone said, I just started wearing glasses about 6 months ago. I wear them to watch television, but when I take them off, everything is blurry. Is there anything I can do to get rid of the blurriness, or should my glasses be changed?
Well, it depends. Sometimes patients have glasses that are strictly for distance. So when you take them off and you look up close, you're kind of going, whoa, that's not clear. Your eye muscles need to refocus to see it, and it can take a little bit longer than it used to. Some patients like to just keep them on, maybe have distance and near vision all in one pair so you can focus at all distances and not have that eye strain.
This is a question a lot of people probably want to know the answer to. I'm not sure if this is your specialty, but how do you get rid of bags under the eyes?
Well, I will say there are many creams out there for under the eyes, darkness under the eyes, and you just want to be cautious because a lot of those creams can block the oil glands, cause dryness. I like to use ice packs, cucumbers, nice cold compresses to really kind of constrict that blood flow and get rid of that discoloration in bags.
Someone says, I am 40 plus and constantly use my cell phone and laptop for work. At the end of the day, my vision gets blurred to the point I can't see small print. Is that normal at my age?
It definitely can be normal, but something that can be treatable with different corrections, whether contacts, glasses. There's a lot of new treatments out there. So we don't want the eyes to be strained, and we understand there's so many patients on screen time all day long, and that can really cause the eyes to feel tired and fatigued at the end of the day. So definitely talk with your eye doctor about options to help slow that down and prevent it.
Someone asked, is there anything that a person can do to fix up-close vision without having to wear glasses?
Yes, there are contact lenses are an option, and there are some new options coming to the market very soon here that are prescription medications that could help your near vision without the use of glasses.
If you have cataracts, when should you have them removed?
That depends. Some patients we see cataracts at an early age. They're very small. I say they're not ripe enough to remove surgically. You got to be careful not to do it too soon. Insurance may not cover the removal, but we don't want to wait too long because they can be harder to remove surgically. So definitely consult with your eye doctor about the right time for removal.
Someone's asking, sometimes my eye twitches. Is that normal?
I saw a lot of twitching of eyes today in my clinic, and a lot of different causes. We always ask patients, are you dehydrated, lack of sleep, stress, fatigue, low magnesium levels, hormones, or even excess chocolate can cause that. So a lot of variables with that.
Excess chocolate?
Yes. I know.
That's interesting. Somebody said, I was recently prescribed Restasis for dry eyes. Is this something I will probably need for the rest of my life?
I tell patients, once we start a dry eye prescription medication, it is something that more than likely they'll need long-term. We can always look at different options for dry eye, such as punctal plugs or membranes on the eye. A lot of new treatments out there.
All right, Dr. Wruble, thank you so much for your time and your expertise. We've got her contact information in the web story on WFMYnews2.com, so if you'd like to contact her, you are more than willing or more than able to do that there. We're also going to be putting these segments in our web story so you can watch them again.